The opioid epidemic has been a rising problem in the US for the past several decades. With the increasing use of these powerful opioid painkillers in the medical industry beginning in the late 1990s, addiction and abuse of these drugs began to rapidly spread throughout patients. This abuse led to a major uprising in the use of heroin and fentanyl, as the properties are very similar to those of prescription opioids, but come much cheaper and more powerful. Due to the uses of these illicit and powerful drugs, recently, the Midwestern region of the United States saw a rise of deaths related to opioid overdose by 70% from July of 2017 to September 2018, along with the national death by opioid overdose rising by 30% in that same time. This dramatic increase of overdoses has led to major social impacts throughout the US. The opioid epidemic has led to the abuse of approximately 2.4 million people and the death of 30,000 in the past year. With the majority of these users being ages 25 to 44, many families across the US are being struck with tragedy. Children are ending up in foster care or are being raised by grandparents, and relationships are being torn apart due to the illicit use of opioids. Along with deaths and abuse, the US has seen a rise in HIV and AIDS within the age group of 25 to 44. Even with all these statistics, only 11.5% of people in the Midwest, the most affected area of the epidemic, believe they have a drug crisis affecting their community. The opioid epidemic has brought much attention to medicine and politics, but can't bring attention to most Americans. This discourse has created a barrier against helping victims of the opioid epidemic and informing the public of steps to take in order to help reduce this epidemic. Despite the many steps that have been taken to reduce the impacts of opioids on people through medicine and the development of different painkillers, nothing has been done to create a greater awareness of the epidemic for the US population and their discourse towards it. Through my research, I was able to create a solution to help influence the discourse towards the opioid epidemic and even help lower fatality and consequences of it. I spent lots of time looking into the country of Portugal and their laws regarding illicit narcotics. This country changed its laws regarding the personal use of all narcotics from a criminal felony to administrative punishment, including fines and treatment plans, in 2001. This meant that punishment is not given to people unless their possession of narcotics is more than a 10-day supply. After the implementation of this new law, Portugal saw high decreases in overdose deaths and HIV infections. This led to the reduction of need for HIV treatment, incarceration rates, and the destruction of families throughout the country. Using this information, the US can follow this model to implement the reduction of narcotic laws. This reduction could lead to the reduced use of opioids, better means of informing the public, and change the overall social discourse towards the opioid epidemic. These outcomes can be accomplished in two main ways. 1. Immediately implementing the reduced laws against narcotics, or 2. Allowing the public to vote state to state on whether this law should be used. If the law was implemented immediately, safer distribution of narcotics would start to rise and knowledge of this epidemic would come to a forefront of the US. If the law was voted on state to state, it would bring an enormous amount of attention to the problem and would change the mindset of many, even if it was voted no. In conclusion, the introduction of the decriminalization of narcotics in the US would change the ignorant social discourse of the United States and start to decrease the opioid epidemic as a whole.